Alcoholism. Note: remember in a psych question if you are asked to prioritize. Do not forget Maslow. Use the following priorities. 1. Physiological. 2. Safety. 3. Comfort. 4. Psychological. 5. Social. 6. Spiritual. Also, all psych patients start as med-surg patients. Rule out all feasible med answers before picking psych answers. First, psychodynamics of alcoholism. A. The number one psychological problem in abuse is denial. Definition: refusal to accept the reality of their problem. Treatment: 1. Confronted by pointing out to the person the difference between what they say and what they do. 2. In contrast, support the denial of loss and grief, because the use of denial is serving a functioning person. B. Dependency or codependency. Dependency: when the abuser gets the significant other to do things for them, or make decisions for them. Codependency: when the significant other derives positive self-esteem from doing other things for and making decisions for the abuser. Treatment: 1. Set boundary or limits and enforce them. Agree in advance on what requests are allowed, then enforce the agreement. 2. Work on the self-esteem of the codependent person. C. Manipulation. Definition: when the abuser gets the significant other to do things for him or her that are not in the best interest of the significant other. The nature of the act is dangerous or harmful to the significant other. Treatment: 1. Set limits and enforce. 2. It's easier to treat than dependency or codependency because nobody likes to be manipulated. Second, what is Wernicke's or Korsakoff's syndrome? A person can be psychotic. A. Psychosis is induced by vitamin B1 thiamine deficiency. B. Primary symptom: amnesia with confabulation, making up stories to fill in memory loss they believe is true. C. Characteristics: preventable by giving B1 vitamins. Arrestable: can stop from getting worse, not imply better. Irreversible: dementia symptoms don't get better, only worse. Third, Antabuse or Revia. A. Disulfiram, drugs used for alcoholism. B. Aversion therapy. C. Onset and duration of effectiveness: 2 weeks. Take drugs 2 weeks and builds up in blood to a level that when drinking alcohol, will become horribly sick. If off for 2 weeks, will be able to drink without sickness again. D. Patient teaching: avoid all forms of alcohol to avoid nausea, vomiting, and possibly death. This includes mouthwash, aftershave, perfumes or cologne, insect repellent, vinaigrettes or your salad dressings, vanilla extract, elixirs. It contains alcohol over-the-counter med, alcohol prep pad, and alcohol sanitizers.